Computer. Hi, everyone. My name is Eangelica Aton, and we are Healthscape.me, Team 7 for Bangladesh.
Hi everyone, I'm Pashmi Liyanage. I'm a fourth year medical student studying in Italy.
We're here today because over the past few years, type 1 diabetes incidence in Bangladesh has risen and is currently estimated at 4.2 per 100,000 in the population. What we're addressing as a primary problem that we're really trying to provide a solution for is this shortage of safely refrigerated insulin due to power outage and lack of infrastructure in many rural areas throughout Bangladesh. The population is 165 million. It's divided into 64 administrative districts. Lots of social challenges that impact the care for patients with type 1 diabetes, including, among others, problems with education, poverty, and low employability. Girls often get married early, and there's often suboptimal family and societal support for patients with the type 1 diabetes. There is a type 2 diabetes registry that we hope can be replicated and in the future built upon for T1D registries. Healthscape.me, what we wanted to really look at is the effects of type 1 diabetes, especially for rural access where there is no refrigeration. This lack of emotional support, which impacts lack of physical, metabolic, nutritional control, is very disempowering for all patients and children, as well as their families. This lack of refrigerator access becomes a societal, I would say, problem throughout not just the main hospital units, but throughout each family, each community. It's very difficult to collect predictive supply and demand data throughout rural areas, let alone predict 24/7 access to refrigeration. This impacts every member of the family. The caregiving hardships or economic burdens faced by many families that would otherwise help us deal with addressing and preventing shortage of all related insulin supplies. We took a look very closely at a heat map, and the very example here we understood was how COVID-19 prevalence and incidence in Bangladesh was monitored. So we know that from a public health perspective, there is definitely an aim throughout to address not just diabetic patients, but even COVID-19. So if we can launch a similar website and application that can eliminate unplanned insulin shortage by collecting public health information as well as pharmacy level information, this can help to produce, I would say, a dashboard that can better mobilize and also predict and gather insight for predictions on supply and demand trends for insulin distribution and insulin care. So as a part of this, to incentivize users, we know that there is some opportunity to work with the teaching hospitals. Many of the mentors and partners who we worked with here this weekend at Harvard and throughout, we want to create a sense of community. The use case here could be either for a doctor, a patient, or caregiver. We even have an idea of an avatar so that children and type 1 diabetic families can really engage in the use of a gamified way to answer healthcare questionnaires, either daily or weekly, especially when they come into clinic. This can also be gathered to help understand who's having real access and shortage throughout. So very quickly, what we wanted to summarize is that Healthscape.me is an end-to-end holistic solution. You can see here how we've described very quickly of both support for the patient, informative support, caregiver support. Through the launch of our app, what we want to be able to do is partner with all the teaching hospitals throughout the country, starting with 1 or 2 initial pilot campaigns in the capital as well as the larger teaching hospitals. The main point here is adding the locus of control for the governance, the academic centers, as well as the families. This needs to be done in a culturally sensitive way, such that we look at the entire disease prevention as well as care management for type 1 diabetics. We know that if there's early access and assessment with education, we know that if there's early and repeatable access to refrigerated insulin, compliance and hopefully quality of life will be improved for all. Thank you so much. We are Healthscape.me. We've been very excited to be here this weekend for the Innovation and Global Health Systems Hackathon with Harvard and MIT Medicine. And on behalf of myself and the many mentors we spoke with this weekend, we want to thank you and especially address our mentors in Bangladesh with this solution. Thank you, everyone.